So I'm going to introduce to you Bonnie Kaplan. She has a PhD, a professor emerite in the Cummings School of Medicine at the U of C. She's originally from Ohio, and she did all her training in the US, in Chicago, and Brandeis University. She did that in experimental and psychological psychology. Her interest in the biological basis of our behavior has led to her postdoctoral training, and then her faculty research in neurophysiology at the West Haven VA Hospital, Yale University Department of Neurology. Until she moved to Canada in 1979, she has published widely on the biological basis of development disorders and mental health, particularly the contribution of nutrition to brain development and brain function. So please help me welcome Bonnie.
Thanks very much. Now I have to start out by telling you that I have a tendency to get laryngitis. I've had it many times in my life, and I had the worst case of my life last week. So I'm delighted to have a microphone, and I will try to make sure that you can hear me. But what I've done in my talk actually is I've separated out a couple of segments. If my voice is really going, I might abbreviate this just a little bit, and we'll do more of a discussion, okay? I made the mistake of having a 45-minute conference call with some people this morning. I shouldn't have done that. Anyway, it's delightful to be here. My title is Micronutrients for the Brain. It's conventional in my world, in the medical faculty, to start out with a disclosure slide. And it's very important that you understand that even though I will be mentioning some brand names, because I always say that if you're going to study nutrients in pill form, as I've done for many years, you've got to feed your patients something, and I'm not going to go out and set up companies. So I will be mentioning companies, but I have never been commercially affiliated with them, have never accepted a dime. They do not fund research. Those of us in the mental health world who are studying nutrition remember what it was like many years ago when research was not funded by companies. That all changed in the 70s when the pharmaceutical world took over research on drugs for mental health. And so we've gone back to the old way of doing things, which is staying independent. But more importantly for this group is what I call a disclaimer. When Sylvia asked me to speak to you, I said, I don't know anything about neuropathy. That's not what I study. And she said, oh, our group is just interested in brain health. And obviously mental health is a function of brain health, and nutrition is absolutely essential for brain health. And so we decided that if I talk about the area that I know something about, some of it anyway will interest you. And at the very end, if you'd like, I'll tell you my one case with neuropathy, which is mixed results. Okay, now when I talk about nutrition, I like to start out by pointing out that I think of it as there being two sides to the coin. One is what we eat that maybe we shouldn't eat. And you can think of a lot of stuff that you've eaten that you shouldn't eat, I'm sure. But for example, if you are sensitive to gluten, don't eat it. You'll figure out if you're sensitive to it. You can figure it out on your own. Dairy, etc. And none of us should be eating processed foods very much at all by now. If you're smart enough to care about nutrition, you're cooking from scratch and not eating processed foods, so you're not getting all the artificial ingredients. But the other side is what we should eat, but we might not be getting enough of. Can you all see the slides from where I'm standing, okay? All right. So what should we be eating that we're maybe not getting enough of? That includes minerals and vitamins, which are the area that I've spent a lot of my career studying, and also omega-3 fatty acids, which we can just take for granted. We should all be eating fish or taking omega-3 fatty acids for our brains and for our hearts. And if you're not doing that, I urge you to do it. But I won't be covering the omega-3 research. I'll be talking about minerals and vitamins, my area of expertise. So this is an overview of, I spent a lot of time trying to figure out how should I formulate this talk to a group that really maybe has no interest in mental health. And then I thought everyone has an interest in mental health these days, right? Okay, so I don't think I'm going to bore you, but how could I present it, especially in terms that would make sense to a group that wasn't You might not have even known you were coming to a mental health talk. That wasn't even in the ads, you know. So here's my overview. First, I'm going to try to explain to you why we need to pay attention to mental health in general, just as members, members of society, and especially because it's not your group's focus. Secondly, why pay attention to nutrition in relationship to brain and mental health? Usually we talk about brain and mental health, we talk about everything except nutrition. Our newspapers don't cover any of the nutrition research that's coming out all over the world in relationship to mental health. They're not interested. Anything on mental health that they cover is drugs, conventional treatment, and improving psychotherapy, cognitive behavior therapy, etc. They almost have it blackballed. It's quite odd. And thirdly, what types of data confirm the importance of nutrition for mental health? Then, if we still have time and I still have a voice, we'll talk about some societal issues that I think are really important. So the first one is quite brief. Why pay attention to mental health in general? Because we have a problem of epidemic proportions. And I'm going to show you just one reference, and you've probably never heard of it before, but everyone should know about this. E. Fuller Torrey is an 80-year-old psychiatrist in the States. He's been a leader in the field field of mental health, not nutrition, mental health, for 40 or 50 years. He became interested because his own sister, who he grew up with, had really severe schizophrenia, and he devoted his life to it. He's a very smart man on top of this field. And he published a book in 2001 with an author named Judy Miller, which has just been neglected. It's called The Invisible Plague. But what's interesting to me is why he wrote it. The reason he wrote it is he was alarmed that the prevalence of what we called insanity at the time had risen, from 1/100%. It had tripled to 3/100%. Now I want you to understand that this was based on really good data. They had scoured the world for government data, and they got really excellent data back to 1750 from England and Wales, Ireland, the Atlantic provinces, and the USA. And they wrote this book. We're really alarmed because the prevalence has tripled from 0.01 to 0.03%. Whoops, I went the wrong way, sorry. So this is how this looks. And if you think that I've put invisible bars on here, it's because in a moment you'll understand we can't even see the 1/100th to 3/100%. It's so tiny. That is 1 in 10,000. And then from 1750 to 1960, it's 3 in 10,000. Interestingly, during the Irish famine, not enough food, it went up even higher to 7 in 10,000. Now, who wants to guess from the audience what it is today? What have you heard? Have you heard anything? No? Okay. Our best guess now, and this is just since the year 2001, when he published this book, is that it has gone up to over 20% of our population in North America is diagnosed and being treated for a mental disorder. And I want you to think about the people who are in your families, your close friends, their children. Is there anyone here who does not know someone struggling with a mental disorder, mood disorder, anxiety, OCD, ADHD? Is there anyone here who doesn't know someone like that? That's what I usually find now, even in much larger audiences. And folks, it wasn't like that when I was a child. It absolutely was not. We knew there were a few people who had problems, and they were very few, but it wasn't 20%. So the take-home message to point 1 of my overview is, or my outline, we have a problem of epidemic proportions, and interestingly, conventional treatments are not helping much. Why do I know they're not helping much? I'm not saying that medication helps no one. Please don't take that message away from this talk. But medications really took off in the 1970s, 1980s, and now almost 20% or roughly 20% of our population in any given year in Canada is taking a psychiatric medication. And yet, the rate has not gone down. Okay, and so from that I conclude that they're not quite sufficient. Why pay attention to nutrition in relation to mental health? I wish I had a lot of time with you, but if you're interested, I have a number of lectures on the internet, and I'll give you mine, and you're going to give me this recording to add to that list. One reason to try to speak clearly, I guess. And one of those lectures is on the history of what we know about nutrition and mental health. And you wouldn't believe it, but in the 1920s, going back to the 1800s, going back 2,500 years ago to the first clinical trial of nutrition, everybody knew that nutrients were fundamental for good mental health. I don't have time to cover that here, so I'm going to give you just one study in the context later on. So the real reason to pay attention to nutrition, of the role of nutrition in relation to mental health, is that we know it's important. And in fact, what I want to show you is that brain health is probably more dependent on optimal nutrient intake than any other organ in your body. Are any of you cardiologists? Okay, if there were cardiologists here, they might argue with me. There's this debate as to which organ eats up more of the nutrients, but most people think it's our muscles, but that's not the case. So our brain accounts, it's very tiny, it's only 2.5 to 3 pounds, or a little over a kilogram. It accounts for only about 2%, pardon me, of our body weight, but it sucks up 20 to 50% of the nutrients we eat. So when you're eating, you are eating for your brain and your heart, okay, and everything else, but especially think about your brain. This is one statistic that people find really interesting. Each of us has about 6 liters of blood circulating at all times. About 1 liter passes through our brain every minute that our heart is beating. That's a phenomenal amount. That means I've been speaking for 10 minutes. I have a clock in front of me. That means 10 liters, just picture 10 liters of blood have gone through your little tiny brain in that time. Why? Why did we evolve to have that much blood circulating in our brain? I'll answer that in a minute. You think of what you think is the answer. This is just a picture I like to show. Yeah, it shows up pretty well there. I think it's quite astounding to see the blood vasculature of the human brain. This is, if you've ever seen human brains before, this is the frontal lobe, temporal, occipital, the brainstem going down here. And the complexity of the vasculature is phenomenal, okay? So now, anybody want to tell me why that much blood is going through our brains? What's it doing?
Bringing oxygen.
Yes, thank you, bringing oxygen. And we should probably mention that first, because it is the most important. But of course, I'm not here to talk to you about oxygen. We're going to talk about nutrients. And those are the 2 things especially that are being brought into the brain. So in the last 10 minutes, what nutrients were going into your brain? Think back to what you've eaten in the last few hours. You don't have to answer it. Now, by the way, I know how bad it can be. Anyway, there are other things that blood is doing. I don't want to make you think it's only those 2 things. There are a lot of other immunologic factors that are circulating. And of course, that's how we get rid of waste products. So there are lots of reasons to have so much blood circulating in our brain. But what I want to focus in on, of course, is nutrients. So why so many nutrients every single minute? To answer that, I want to teach you a little bit about brain metabolism. Is there anyone here with a biology background? There must be a few of you. No? That's okay. I'm going to show you a slide now that I show in every single talk that I give. That means that there's at least one person here who should have it memorized because he comes to a lot of my talks. Wade, you know who you are. So, but I won't quiz you. But I show it to people in elementary school, junior high school, high school. I show it to family doctors. I show it to the American Psychiatric Association because every time I show this slide, people say, now I understand why we have to feed our brains all the time. So don't find, please, I hope this doesn't look daunting. I'm just going to explain it to you. I'll tell you the story behind it. About 15 years ago, I was already studying the use of nutrition to treat mental disorders. And I was always being asked, what's the mechanism? And I mean, I had this basic, as you heard from the introduction, I had training in neurophysiology, but that was more in electrophysiology than in biochemistry. So I had to train myself a bit on biochemistry. So I had a basic understanding that nutrition was important for the brain. But I couldn't point to anything. So I went online, the internet was still pretty new, and I said, okay, if I wanted to make a picture of what nutrients are doing in the brain, I would pick a neurotransmitter that everybody recognizes, because I also speak to lay audiences. So I picked serotonin. You can see it over here. Does my arrow show up?
Yeah.
Okay. So serotonin's over here. And so a lot of people know that tryptophan is a precursor to serotonin. We synthesize serotonin in our brains. We don't eat it. We eat the precursors, which enable us to synthesize it. That's true of a lot of the important chemicals in our brain and body. So I thought, okay, I'm going to go in and clip a chunk of the biochemical pathways that show the metabolism that enables us to synthesize serotonin and break it down, because you have to break it down too. And I picked this for one simple reason. It fit on one slide. So it's quite random, quite arbitrary. And this is what I found. Oh, I didn't explain yet. The arrows are metabolic steps. Metabolism just means one chemical being changed to another. And usually, probably always, that's done with an enzyme. And enzymes, you've heard that word, I'm sure, enzymes don't work without cofactors. Vitamins and minerals are the cofactors. So I said, okay, let's click on each of these arrows and find out, I didn't care about the names of the enzymes, but find out what vitamins and minerals were required for that step to work. And this is what I found. Here's vitamin B6, which actually is in several steps here. Copper there. How many of you think about eating copper? Iron is there. Iron is there. It's what?
Is that pennies? Pennies.
Pennies, not copper pennies. Don't eat your money. Molybdenum. How many of you have heard of molybdenum before? It's an essential nutrient. It's essential dietary minerals. It's in a number of our vegetables, lentils, things like that. Okay? So in other words, for us to adequately convert tryptophan to serotonin and then to break it down, like there, metabolize it, we have to have all of these nutrients in our brain at all times. We have to be eating them. And I don't think you can find them on this slide. And maybe that's amusing, but guess what, folks? Years ago, it was shown that 25% of the calories our teenagers eat are on this slide. And when is the peak onset of mood and anxiety disorders? Teen years. Send them off to college, university, they're living on ramen and this kind of food, and that's when they end up psychotic, bipolar disorder, etc. So it's a very serious issue. Now, since that time, because that was 15 years ago, I've also made up slides for the omega-3s and for dopamine, but I'm not going to bore you with them. They all show the same thing. This is the omega-3 line. I thought I'd show that to you because you probably know what EPA and DHA are. And it's the same story. If you ask what the enzymes need, you get a list of micronutrients. Micronutrients meaning minerals and vitamins. For anyone taking notes or pictures or whatever, you're welcome to do that. But if you email me at the end, and I'll give you my email address, I'll send you my slides, okay? So the take-home message so far is that we eat for our brains, and that optimal brain function requires a broad spectrum of minerals and vitamins for metabolism. And that's why it kind of makes me crazy when people say to me, oh, I take vitamin D, that's going to help me with my mood, right? Well, yeah, it's one of about 50 micronutrients, so, you know, you're 1/50th of the way there. But it's magic bullet thinking to think that a single nutrient is going to optimize brain or bodily function. We need all of them. And we need them in balance, okay? We need them together. Okay, my third topic was what types of data confirm the importance of nutrition to mental health. So you might not care about the kinds of data, but it does enable me to try to show you how robust this field is. We have people all over the world studying this. We're not getting publicity. The public isn't interested, the psychiatrists aren't interested because they get their education from pharmaceutical companies. Obviously, pharmaceutical companies aren't interested because what we're showing is the importance of nutrition for brain health. So whenever I can, I try to let people know, hey, this is out there and it's really well supported. So I'm going to cover 3 kinds of data. The first one is very briefly correlational. That's where 2 things go together, but you can't conclude anything about causation. But just so you know, there are massive studies, and nutritional epidemiologists collect data on thousands of people. They spend lots of money. I wish they'd quit doing their research already because they all find the same thing. I just don't think it's useful to keep studying this, but they all find the same thing, and that is that a Mediterranean whole foods diet is associated at the population level with lower rates of mood and anxiety problems, and a Western processed foods diet is associated with higher rates of mood and anxiety problems. Okay? Now let's test you. Which kind of diet is this?
Mediterranean.
Thank you, Mediterranean. It's not even complete. Dairy could be on there, meat could be on there, but basically fish, vegetables, fruit, legumes, nuts and seeds. Okay? Whole foods. And we know what this is. And how many of our, there was just a study out, and I've lost the reference, so I don't have it on this slide, but a study just came out about a month ago, I think, showing that it's not just 25% of our teens who are eating like this, but there's 50% of our adult population is eating mostly processed food. I think that's the way they worded it. So I've got to get that reference so that I can say it adequately. So we really have a problem. People are not eating, cooking from scratch and all. Now, correlational data is nice. I just informed you about something, the value of the Mediterranean type of diet. But when you're studying mental health problems like mood, there is a big problem with that kind of data. And that is that you don't know what causes what. Because when you are feeling blue, do you crave broccoli? No. So what causes what? When we're feeling down, we go for junky food. So all those studies I just told you don't prove what causes what. But fortunately, we have some studies that do show it. So to really prove causality, we need 2 kinds of information. I'm going to show you examples of each, but as you'll see, I can't cover the whole field. You'd fall asleep. But one is, instead of correlational studies, we need prospective longitudinal studies where we study people here, and then we say, let's just monitor them and see what their diet is, and then find out if the people with the better diet are mentally healthier. Then you can say something about causation. And the other thing we need is treatment studies. So we have about, and I'll show you those, we have about 4 or 5 of these prospective longitudinal studies now. And I always, for several years now, I've been using this study to illustrate it, even though there have been additional ones. I think it really gets at it so well. So this was a study published from a very large cohort in Spain. And the participants were professors and university students who had no signs of mental disorder at the beginning. Okay? But eventually, life happens, and some of them end up with a diagnosis. But at the time the study began, none of them met criteria for any disorder. So they were given food frequency records and asked to report how often they ate commercial baked goods, which they defined as muffins, donuts, and croissants, or fast foods, which they defined as hamburgers, sausage, and pizza, and they put them all together as an unhealthy diet score, basically eating a lot of processed food, or eating processed foods. So before I show you what they found, I want you to think for yourself about what you eat, but we're going to fictionalize this, okay? So let's say, what do we have here? 4 rows, not easily divided in thirds. Okay, let's say the first row is 1/3 of the audience, and you guys, on your food frequency questionnaires, you reported hardly ever eating pizza and donuts and all of that stuff. So you had a very low score. Then the middle of the room, you occasionally like your muffins and donuts or whatever, and so you were kind of the intermediate group. The people in back you reported a very high level. You were the highest third, okay, for eating all of those processed foods. And then the scientists sat back and waited to see, and because they have this kind of government data they can access, who would end up with a diagnosis of a mood or an anxiety disorder, okay? And you can kind of guess what they found. So they arbitrarily set 1 as the risk for depression for the people in the front row. They said, okay, you're eating as well as you can, but everybody has a certain risk. And then they compared the middle group, and it's amazing. You guys were eating those foods, but you didn't have any higher risk. There's no difference between 102 and 1, okay? So there is no difference between you guys and you guys. You people in back are in trouble, okay? You had a 50% increased risk for a diagnosis of depression and anxiety. Now, what am I saying here? Am I saying that muffins cause depression, and because you're eating so many of them in back there, that you're at higher risk? No, that is not what I'm saying. What I'm saying is that with every bite, we're making a choice. And if you're frequently choosing processed food instead of this kind of food, then you're at risk. And we don't know whether it's the donuts increasing your risk, or the fruits and vegetables decreasing your risk, or a combination of the two. But it's the overall balance of your diet. Does that make sense? So I hope that convinces you. Oh, I didn't point that out, but maybe you saw it on the slide, that they were weighted an average of 6.2 years to have 9,000 people to analyze. Okay, so they gave it a good period of time. There's an Australian study in children that waited 2 years, and they also showed that diet predicted which of those preteens would be diagnosed. Very interesting.